Good afternoon, Honourable Ministers, distinguished guests, ladies and gentlemen. It is my great pleasure to welcome you to the launch of the WHO Health Emergency Appeal 2025. To begin, I invite the WHO Director General, Dr. Tedros Ghebreyesus, to provide opening remarks.
Thank you, Moderator. Excellencies, Honourable Ministers, dear partners, colleagues and friends. Good morning, good afternoon and good evening, and a very happy new year to all of you. And thank you for joining us today for the launch of the WHO Health Emergency Appeal for 2025. My thanks also to all of you who sent me messages after my narrow escape in Yemen. Of course, it was scary and also dangerous. I'm still suffering from tinnitus in my left ear, which my doctor has told me may last for months, but I hope it will go away soon. I was fortunate, but the ringing in my ear is a constant reminder of the threat that so many people live with every day in conflicts around the world, including our WHO staff, UN staff, health and humanitarian workers. In Yemen, years of protracted conflict have left millions vulnerable to disease and malnutrition. In Sudan, almost 2 years of civil war and catastrophic displacement have left 70% of health facilities non-functional. In Ukraine, more than 2,000 attacks on healthcare over almost 3 years of more have caused significant damage and eroded hope. And in Gaza, almost 70% of deaths are women and children, which underscores the heart-wrenching human toll of this conflict. Yesterday's announcement of a ceasefire and hostage release deal between Israel and Hamas is of course wonderful and long overdue news. We very much hope that this agreement will be approved by the Israeli cabinet, that it will be honored and implemented by all sides, and that it will lead to a lasting peace. Because as we always say, peace is the best medicine. We can only hope that this year we will also see peace in Ukraine, Sudan, and the other troubled corners of our world. In the meantime, WHO will continue to respond as best we can. And even when these wars end, because all wars do, we will continue to support the work of rebuilding and recovery. Of course, conflicts are not the only emergencies to which WHO is responding around the world. Last year, we responded to 51 emergencies in 89 countries. And these are conflicts, outbreaks, climate-related disasters, and more. These emergencies are no longer isolated or occasional. They are relentless, overlapping, and intensifying. In 2025, we estimate that more than 300 million people around the world will require urgent humanitarian assistance. Amid this escalating need, we're confronted with another challenge, a widening gap in humanitarian funding. In 2024, global health sector funding met barely 40% of needs. Without adequate and sustainable funding, we face the impossible task of deciding who will receive care and who will not. This year, WHO is seeking $1.5 billion to support our life-saving work for the emergencies we know about and to react swiftly to new crises. With a presence in over 150 countries, we act before, during, and after emergencies, from rapid needs assessments to coordinating and delivering large-scale humanitarian health response and rebuilding. From controlling outbreaks to providing mental health support in conflict zones, WHO's work extends beyond the immediate care we provide. We empower communities to protect themselves, prioritize equity, and build a legacy of preparedness. And when one country is safer, every country is safer. But WHO cannot alone meet the scale of the challenges we face. We need the global community to step up and match our commitment. Today, I'm here to ask for your continued support. Every life saved today lays the groundwork for resilient health systems of tomorrow. Excellencies, colleagues, and friends, this appeal is not just about numbers. It's a collective commitment to save lives, uphold the universal right to health, and restore dignity to communities in crisis. Your support helps to ensure that WHO remains a lifeline, bridging the gap between sickness and health, despair and hope, life and death for millions of people worldwide. I thank you. And moderator, back to you.
Thank you very much, Dr. Tedros. And now let us turn our attention to those impacted by health emergencies and those responding on the front lines. In this video, we witness the immense challenges that many are facing, from conflict and climate to devastating disease outbreaks. These are the key drivers of health emergencies. Next, we'll hear from Her Excellency Anne Birte Tvinnereim, the Minister of International Development of Norway, who will speak on the importance of partnership, of monitoring attacks on healthcare, and supporting WHO's work in country.
Norway commends the WHO for its global leadership and tireless efforts in addressing health emergencies across the world. Your coordination and response are critical to ensuring life-saving healthcare for those most in need. Your operations take place in challenging emergency settings, including armed conflicts, such as in Ukraine, Sudan, and Gaza. I am extremely worried about the increasing attacks on health facilities and health workers. Let me use Gaza as an example. Since the 7th of October 2023, WHO has verified 654 attacks, which severely has disrupted vital medical services and deprived people in desperate need of their life-saving treatments. This is completely unacceptable. Hospitals and other health facilities must remain safe havens for patients and health workers. This is also why Norway supports the WHO's monitoring mechanism, Attacks on Healthcare. Updated and accurate information is a critical component in ensuring accountability according to international humanitarian law for all parties to conflicts. Global health and humanitarian response are two interlinked priorities for Norway. Access to essential health services is a basic human right. We support WHO's approach to combining life-saving interventions with long-term capacity building and system strengthening. This empowers countries to become better prepared for ongoing and future challenges. WHO's health emergency appeal needs sufficient funding. I encourage all donors to prioritize this appeal to assist the most vulnerable populations affected by acute and protracted health emergencies. We need WHO to be able to conduct immediate and emergency health services. My government will continue its support, including through the WHO Contingency Fund for Emergencies and specific appeals in new or escalating crisis. Thank you.
Thank you very much, Your Excellency, for your insightful remarks. We're now going to hear from some of our esteemed partners delivering healthcare in conflict-affected and hard-to-reach areas, including Ukraine, Lebanon, and Gaza. First, let us hear from Dr. Irina Voloshyna from the Academy of Family Medicine in Ukraine. You have the floor.
Ladies and gentlemen, dear colleagues and friends, warm greetings from Ukraine. Thank you for the opportunity to speak today about crucial topic, access to healthcare in Ukraine, particularly in the context of ongoing challenges caused by the Russian full-scale invasion since 2022. As representatives of Academy of Family Medicine of Ukraine, we are dedicated to improving health outcomes for our citizens, especially in outreach and underserved communities. Our mission is rooted in the belief that everyone deserves access to quality healthcare, regardless of their geographic and socioeconomic status. However, these challenges have also fueled our commitment to serve the most vulnerable populations. Our efforts have focused on several key areas. First, the outreach we have established since 2022 ensures services can be restored, bringing hope to communities and people and building trust in healthcare systems. We have launched initiatives to provide essential healthcare services in areas heavily impacted by military actions. Our teams of healthcare professionals deliver medical care directly within communities experiencing displacement and limited access to facilities. Through mobile clinics and outreach programs, we ensure individuals receive essential primary care, including vaccination, maternal and child health care, and chronic disease management, even under daily missile shelling and drone attacks. Second, our collaboration with WHO builds on the skills of Ukrainian nurses and doctors, ensuring we have local providers and sustainable actions. We recognize the importance of first aid and mental health support during crisis. In response to the increased psychological care needs, we have integrated mental health services into our primary healthcare framework. Utilizing tools like MHGAP, we align with the All Ukraine Mental Health Program led by the First Lady, connecting policy to practice. Third, our investment in primary care is crucial. Our experience during these years of war shows that investing in primary care contributes to early recovery. This investment underscores how WHO is a trusted partner for both response and recovery through programmatic approaches. Our collaboration with WHO has been invaluable. The attention and efforts of Tedros Ghebreyesus, Michael Ryan, Hans Kluge, Jarno Habig, and the whole team have saved the lives of Ukrainian people and are much needed in 2025. WHO team provided technical support, essential trainings for medical staff, and resources to enhance our response to healthcare needs. Working alongside WHO, we have implemented health programs addressing the immediate and long-term needs of our communities, reaching over 100,000 patients with medical help. The support from emergency medical supplies to guidelines on disease prevention has enabled us to act swiftly and effectively. To conclude, the work of the Academy of Family Medicine of Ukraine exemplifies resilience and dedication. We are committed to ensuring that healthcare is accessible to everyone, especially in these trying times. With the continued support of organizations and humanitarian actors like WHO, we aim to strengthen our healthcare system and empower our communities to overcome their challenges. Thank you for your attention. Your support and shared commitment are vital as we strive to rebuild and enhance our healthcare system in these unprecedented times. Together, we will make the lasting impact of the health and well-being of our nation. Thank you so much.
Thank you so much, Dr. Voloshyna from the Academy of Family Medicine in Ukraine. We're now going to hear from Dr. Zaina Mohana, Executive Board Member of the Amal Association International in Lebanon. You have the floor.
Thank you, Fabia. Thank you, Dr. Tedros, WHO Office in Lebanon and WHO Worldwide for the trust in Amal. Karim is a 5-year-old boy whose family was displaced from Syria and sought refuge in Marjayoun, living in a tent since more than 10 years after the Syrian crisis. One of the villages in the hard-to-reach area, red zone on the Lebanese-Palestinian borders in South Lebanon. The area now is infested with unexploded ordnance after the temporary ceasefire. The ordinances pose a threat on Karim and his family's lives, who can be lost at any minute, as on the lives of thousands of people returning to their villages. His parents are farmers and lost their livelihood after the land was polluted with all sorts of chemicals, especially the white phosphorus, putting the lives of all those at risk. Karim is one of many people residing in the hard-to-reach areas in Lebanon who had limited or no access to healthcare before and during the war in a country faced with compounded crisis for the last 14 years. That also has the highest refugee per capita in the world, showing solidarity, but also faced with economic and financial crises, Beirut explosion, pandemic of the cholera outbreak, and unprecedented scale of injuries and death during the latest war. Amal Association is one of the few organizations that decided to stay in the red zone area next to the people who had no choice to leave or to get displaced during the war, ensured access to health to Karim and his family through a medical mobile unit, thanks to the timely support of the World Health Organization to Amal operation in protecting vulnerable persons in crucial timing. Amal Association, a non-sectarian organization established 45 years ago in Lebanon with more than 40 centers, 23 health centers, 10 mobile medical units, and 1,500 workers, is committed to stay in the hard-to-reach areas and make a difference where needed. Amal is also committed to provide the highest quality of healthcare services to all and committed to advocate for health equity in order to ensure access to health to the most vulnerable, especially the undocumented person, believing that access to health is a global and a human right. This story is one of many success stories in complex emergencies were the coordinated preparedness and response activities among all actors under the leadership of the Ministry of Public Health and the coordination of the health sector co-led by MOPH, WHO, AML, and UNHCR, leaving no one behind by relying on local capacities that have been built over the years, empowering the frontliners to be the first to respond in an emergency and be able to sustain this response. This was not the first time these efforts proved to be essential for the health system in Lebanon that showed an impressive resilience despite being significantly impacted by the multiple crises it faced, leaving it in a fragile state. Additionally, the worst situation had been deteriorating, leading to an increase waterborne diseases and the emergence of epidemic-prone diseases such as cholera, where the coordination within the sector and across the sectors was essential to contain the outbreak in late 2022. Based on our experience, the key role that WHO can play forward and very few can play next to it is to continue the preparedness and contingency planning in order to increase readiness and response capacity at national level during conflict with all stakeholders. This response has demonstrated the importance of preparedness measure being implemented across the whole system. Preparedness plan be included trauma kit prepositioning, capacity building, mass casualty management, and strengthened coordination mechanisms. These measures played a major role in response and are central for any future response. In order to continue investing in local actors that have the reach and the trust of the community they are serving, also, WHO's role in investing in research is crucial, being local, regional, international, in order to prevent the spread of diseases and pandemics, especially within climate change, while identifying patterns and ensuring surveillance and compliance to international standards. 3, sustainable solutions, reflecting the need for sustainable long-term solutions that ensure health systems are not only reactive to emergencies, but also resilient in the face of ongoing challenges. The last point that WHO can play and really make a huge impact on is investing in health system strengthening in order to achieve a resilient and robust health system that is able to respond to emergencies without disrupting normal function. Lebanon, that has been facing 5 years of protracted crisis since 2019, with all type of crises, received only 15 to 20% of its humanitarian needs in reach. We call urgently for continued international solidarity and acknowledging the critical role of donor funding and international cooperation in mitigating health risks during emergencies, being in Lebanon, the Middle East, and all the countries faced with crises by supporting WHO in order to accomplish the distinguished mission it is leading in saving tremendous number of lives worldwide on a yearly basis. Thank you, and we pray for peace for all.
Thank you so much, Dr. Mahana of the Amal Association International in Lebanon. And third, we shall turn to Jennifer Higgins and to Iman Al-Mansara from UK Med, who are based in Gaza. You have the floor.
So much for having me here today. I'm sorry to say that my colleague, Dr. Iman, couldn't join me. She was delayed getting back to her house to be able to join, but such is the nature of movement in Gaza these days. Can you please confirm that you can hear me?
Apologies, Dr. Higgins. We're just going to quickly check the sound just to make sure that we're able to hear you loud and clearly. Could you kindly respond?
Yes, can you hear me?
Is there any way to possibly turn up your volume there?
1 second. Able to hear me?
Yes, now we hear you loud and clear. Thank you so much. Over to you. Thank you so much, Dr. Higgins.
No problem. Thank you very much for having me. And I'm sorry to say that my colleague, Dr. Iman, couldn't join me today. Yes, I am Jennifer, and I am the Deputy Team Lead here in Gaza with UK Med. And I hope my connection stays stable enough for the duration of my intervention. Since January 2024, UK Med has been operating in Gaza, deploying 2 fully operational field hospitals and providing vital support to local hospitals under immense strain.
Our type 2 or secondary healthcare facility in Al-Mawasi provides a range of inpatient and outpatient services, including but certainly not limited to primary healthcare services, 24-hour emergency department, pre- and postnatal services, including deliveries, rehabilitation services, and 2 fully functioning operating theatres. We also have a type 1 field hospital based in Zawaida. It's a primary healthcare facility which offers a range of primary healthcare services, including, advanced wound dressing, rehabilitation, and also pre- and postnatal services. And we also run nutrition clinics through our partner in both of these field hospitals. Through WHO funding, we also work in Nasser Hospital, where UK Med supports the emergency department there. Across all of our sites, our medical teams have recorded over 335,000 consultations so far, treating ill and injured people side by side with local healthcare workers to deliver critical care in what has been really one of the most challenging conditions to provide healthcare services in the world. The dedication of both our national and international staff has really been central to these efforts. As you're aware, the response in Gaza has been incredibly complicated and challenging, and often with huge barriers to providing even basic healthcare services. The health system here has all but been destroyed, and the support of WHO to assist international organisations such as ourselves has really been critical to supporting the people in Gaza at this time. Some of the most critical challenges that we have faced include access for both personnel and critical medical supplies. WHO, and especially the Emergency Medical Team Coordination System, has been vital in supporting our staff with entry and exits to Gaza since the beginning of our response, without which we really couldn't have set up or scaled up the way in which we have both of our field hospitals here in Gaza, as well as our work with Nasser Emergency Department. WHO also supports our primary healthcare facility through funding and is also our main funding partner in our project for Nasser Emergency Department. This project has been critical in re-establishing and capacity building the emergency department services at one of the largest hospitals in southern Gaza. And importantly, it supported national healthcare staff to remain in their roles at an immensely critical time and to be able to manage the large amounts of trauma cases in the area. Also on supplies, it's been immensely difficult during this response to get the necessary supplies we've needed into Gaza consistently. While we strive to be self-sufficient at UK Med, and we have unfortunately had pallets of supplies waiting for months to enter into Gaza. One clear example of this was surgical gauze. At one point, we were so critically low that we believed we might even have to stop providing surgical services at our Mawasi hospital. But WHO stepped in and supplied us with what we needed to be able to continue. WHO has also been critical in supporting emerging public health crises in Gaza, such as the rollout of the polio vaccine campaign. Both of our field hospitals were vaccination points during the campaign, and WHO supported through training of staff, deployment of vaccine teams, providing the entry of the vaccines into Gaza, and greatly supporting the population in the areas surrounding our facilities. WHO has really been vital to the delivery of our emergency health response in Gaza, and we look forward to it continuing into this year with both our existing and hopefully new projects, which will continue to meet the health needs of those most in need and isolated in Gaza during this war.
Thank you so much to UK Med, to the Amal Association International, to the Academy of Family Medicine in Ukraine, and to all of our partners working it tirelessly. We salute you. Thank you. Our next speaker will be Dr. Vanessa Carey, the WHO Special Envoy for Climate and Health. Dr. Carey will address the growing role that the climate is playing in exacerbating health emergencies. Dr. Carey, the floor is yours.
Thank you. And thank you everyone for joining today, because this is truly a critical concern as we come into 2025. The climate and health crisis, whether one chooses to acknowledge it or not, as we're seeing around the world, is here. And it is impacting millions of people right now around the globe. Climate-induced disasters like floods, droughts, heat waves are intensifying disease outbreaks and worsening inequities. No one is immune. In my own country, we are witnessing the impact of drought and extreme weather, leading to fires with over 100,000 displaced, thousands of homes destroyed. It is burning along socioeconomic lines, though, that will drive inequity and we're seeing habitats and communities scarred and air quality decimated. Climate change, though, is not only causing new significant affronts to our health, but it's really accelerating and exacerbating the existing challenges that we see today. And whether it's cholera outbreaks in Malawi that have been caused by climate-induced storms that are shutting down schools and businesses, or the floods in Pakistan, which caused malaria cases to explode in areas where it had been previously declared malaria-free, or whether it is the increasing infectious disease outbreaks, such as we saw in COVID, which closed borders and shut down our economies, our globe, and our way of life. The truth is that poor health, including that is increasingly impacted by climate change, has far-reaching implications beyond just our own health and well-being. It fuels insecurity across communities and countries alike. Poor health destabilizes economies. It widens inequities, and it actually drives political unrest. For example, when it's too hot to work, productivity falls, wages and profits are lost, and supply chains are threatened. When people cannot access essential needs for their families and lives, it can lead to displacement and political, economic, and social insecurity. Climate can undermine and underline many of the conflicts that we're seeing around the world today as we fight for precious resources and lost access to the things that keep our population safe and alive. Right now, the world is more at risk of health emergencies than ever before because of extreme weather, social and political upheaval, and inequities that are exacerbated by conflict and instability. Climate change is only increasing the likelihood of concurrent and more frequent health emergencies, making it even more challenging to respond and putting far more strain on resources and health systems. And that's exactly why the WHO Emergencies Program is so critical. It is a key component in the fight against these deeper and increasingly complex emergencies, which hit the most vulnerable among us the hardest, including women, children, and marginalized communities. And the WHO's response is not simply about providing urgent humanitarian assistance, as we've heard, to those most in need. It's also, as the DG said, about supporting the recovery of countries and the communities after disasters, building the fundamental pieces of health delivery that are so critical across our communities, our societies, and our economies. Because good health is a cornerstone of stable and prosperous societies. And the emergencies response is a powerful component of the WHO's broader work to ensure that billions around the world have access to quality health care. Supporting the WHO means investing in a future where everyone can access the care they need, especially in our rapidly changing and complex world, which is changing politically, it is changing in terms of the environment, it is changing in terms of the inequities, and whether we're talking about climate change or other global challenges. Health is fundamental at its most bottom line to our human security. Thank you.
Thank you very much, Dr. Carey, WHO's Special Envoy for Climate and Health. In addition to conflict and climate, another major driver of health emergencies is disease outbreaks. To deepen our understanding of their impact, I am very pleased to welcome Professor Claude Muvenyi, the Director General of the Rwanda Biomedical Center, who will discuss the devastating effects of the Marburg virus disease in Rwanda. Over to you.
Thank you very much, Moderator. Dear DG of WHO colleagues, His Excellency and partners, thank you very much for the opportunity to address you today during the WHO Health Emergency Appeal 2025 official launch. I'd like to take the opportunity to really share some of the significant steps that Rwanda has taken in responding to recent Marburg virus disease outbreak, and how WHO timely support was critical in our efforts to respond to outbreak. All remember that on September 2017, 2024, Rwanda experienced its first ever Marburg disease virus disease outbreak. This rare and deadly disease presented a serious threat to the public health and placed immense pressure on our healthcare system. So the outbreak, which I think involved many healthcare workers, including clinicians who were working in ICU and also emergency clinicians for two major hospitals within Kigali, the capital city. So the risk of these wide transmissions was really, and the urgency to act swiftly was clear. And from the very start of this outbreak, the government of Rwanda activated its emergency response mechanism, prioritizing the health and also the safety of our people. So we rapidly deployed specialized team for case detections, doing contact tracing, but also ensuring that patients are isolated. So our health teams worked tirelessly to contain the viruses and also protect at-risk populations. The WHO contributions were multifaceted and also critical across multiple areas, and also included things like their very strong technical expertise, rapid mobilization of resources, and also strategic guidance in our response. Allow me to highlight some of the specific ways that WHO supported our response. First of all, thank you to DG for his visit to Rwanda, which I think was very supportive to the response team on the field, but also to the patients through those encouraged words during the visit. So first of all, I think WHO supported the development and the costing of Rwandan's national response plan, and ensured that coordination of all partners for harmonized and also effective response at the beginning of this outbreak. The technical expertise and the search capacity was very instrumental, as we saw the support from WHO in deploying 20 technical experts from regional and also headquarters levels, and also repurposed country office staff to provide continuous support to Rwanda. Additionally, through the AVOC surge mechanism, 39 health professionals from Uganda, Liberia, and Sierra Leone with extensive experience in managing filovirus outbreaks were mobilized and be deployed in Rwanda. This exemplary south-to-south cooperation not only strengthened Rwanda's response capacity, but also ensured critical ICU, but also emergency care gaps were effectively filled following the impact of local health workers. WHO also ensured that provisions of technical guidance and SOP were provided. So they were really critical in supporting our response by really participating in the development of technical guidelines and also standard operating procedures, ensuring that all aspects of the response are aligned with best practices and also global standards, further strengthening our overall preparedness and also response efforts. WHO also facilitated the rapid deployment of laboratory test kits, personal protective equipment, but also other essential medical supplies, ensuring no delay in critical response activities. One of the most challenging pillars of the Marburg outbreak response in Rwanda was case management and treatment. And WHO played a vital role in supporting the establishment and management of the Marburg Treatment Center, ensuring that delivery of safe and effective patient care throughout the crisis. Through that, WHO supports our clinicians, again, confidence in managing the disease, which contributed to a case fatality rate of 23, which I think is one of the most rare cases or achievement in previous outbreak. Considering this case fatality rate for Marburg's outbreak worldwide, which we know range from 24 to 88%, Rwandan's 23% of case fatality rate is one of the remarkable achievements due to the support of all the many partners, including WHO. In research and innovation, WHO played a key role in facilitating the implementation of clinical trials for Marburg therapeutics, contributing to the global advancements in outbreak management. So this response reinforced our profound truths, as we know all that global health security cannot be achieved in isolations. It requires timely interventions, robust coordinations, and also sustained partnership, none of which can happen without adequate but also predictable funding. The partnership between Rwanda and WHO, but also other key stakeholders, stands as a powerful example of what can be accomplished when we unite with purpose, but also with agency. WHO's leadership during Rwandan MVD response was made possible because of resources that were available when they were needed most. However, with the health threats ever present, the next emergency, as we all know, may be just around the corners. Looking ahead, we need probably to make sure that we work together to strengthen preparedness. And we know that the Marburg outbreak, as an example of Rwanda, has reinforced our commitment to building strong public health systems in Rwanda. We are working with WHO and also other international partners to continue strengthening our national preparedness with a focus on early detection, surveillance, and also rapid response. We also recognize the importance of regional collaboration to ensure that countries across the African continent are better prepared to respond to the future outbreaks of emerging infectious diseases. In conclusions, we must continue to investing in WHO critical work, ensuring that organizations remain equipped to respond rapidly, deployed expertise, but also continue to support countries like Rwanda when every moment counts. Once again, we'd like to extend our deep appreciations to WHO for its timely, effective, and also comprehensive support. The collaboration between the government of Rwanda and WHO has been critical in containing the Marburg outbreak. Rwanda looks forward to continue partnership with WHO and also other international partners in the fight against infectious disease. Thank you very much for your attention. Over to you.
Thank you so much to Professor Muvenyi and the team at the Rwanda Biomedical Center. We now move to two of our key contributors to WHO's work in emergencies, the United Arab Emirates and the European Commission. These two partners play a critical role in supporting WHO's efforts to respond to health crises globally. May I first invite Her Excellency Dr. Maha Barakat, Assistant Minister for Health and Life Sciences at the Ministry of Foreign Affairs of the UAE. You have the floor.
Thank you. Distinguished members of the WHO, honourable ministers, ladies and gentlemen, health is central to human dignity and the foundation of resilience, especially in times of crisis. As we face 2025, a year marked by increasingly interconnected health challenges fueled by climate change, conflict, and infectious disease outbreaks, the UAE remains steadfast in its commitment to supporting vulnerable populations. Partnering with the WHO, we are determined to address pressing health needs in emergencies, safeguard lives, and build stronger health systems worldwide. Our approach is rooted in proactive engagement and strategic partnerships. Through our collaboration with the WHO, the UAE has delivered critical medical supplies and humanitarian aid to some of the most affected regions, including Gaza and Sudan, via the WHO Hub for Global Health Emergencies Logistics. These efforts reflect not only our humanitarian values, but also our resolve to tackle global health challenges head-on. The persistent threat of infectious diseases and the risk of future pandemics further complicate the global health landscape. These interconnected crises exacerbate the severity of health emergencies and prolong recovery for affected populations. Addressing these multifaceted challenges requires global solidarity and coordinated efforts to strengthen health systems, mitigate climate change impacts, and prepare for emerging health threats. We know that collective action can save lives. With Gaza, the UAE's humanitarian efforts included the delivery of over 50,000 tons of humanitarian aid and the evacuation of 2,254 patients needing life-saving medical treatment with their escorts. Most of these were women, children, and elderly individuals. The WHO partnered with us in many of these efforts. The UAE also financially supported the WHO's efforts in the occupied Palestinian territories and collaborated with the WHO to alleviate the suffering of thousands in Sudan, South Sudan, and Chad through multiple humanitarian projects. These interventions exemplify the power of partnership in delivering impactful, life-saving support. Looking ahead to 2025, the UAE remains steadfast in its mission to prevent disease outbreaks, prepare for emerging health threats, and build global resilience. Supporting the WHO's health emergency appeal is a powerful act of global solidarity, one that defends the fundamental right to health and ensures that no one is left behind. Together, through partnership and shared responsibility, we are shaping a future where health emergencies are met with strength, solidarity, and hope. Thank you.
Thank you, Minister, for these inspiring words. Next, we'll hear from Hannah Jans, the Director of Policy and Strategy at the Directorate General for the European Civil Protection and Humanitarian Aid Operations at the European Commission. The floor is yours.
Good afternoon, everyone, and I am honored to be intervening today and would like to extend my sincere appreciation to WHO, of course, for its work, and in particular to WHO Health Emergencies Program, as well as to Dr. Tedros and Dr. Ryan for the excellent and long-standing cooperation with the EU and DG ECHO specifically, which I am representing today. Since January 2020, WHO is ECHO's strategic partner. The partnership covers both humanitarian and civil protection aspects and goes beyond the relationship donor-beneficiary. It is the cornerstone for the collaboration between the two like-minded institutions with the same key objective of saving lives. Our partnership already demonstrated its value in response to major humanitarian crises mentioned already here, such as Ukraine, Afghanistan, Gaza, Syria or Turkey, but also when mobilizing for the response to global health emergencies, such as COVID-19 pandemic, and most recently for the cholera outbreaks, Mpox, declared as public health emergency of international concern in August 2024, or the first Marburg outbreak in Rwanda, which we just heard about. The recent years were marked by a recrudescence of violence and conflict. It has been demonstrated that lack or unequal access to health care, as well as the delays in providing response to outbreaks, are important triggers for social unrest. In conflict situations, in fragile context, the delivery of aid based on the humanitarian principles is now becoming an imperative. In this respect, equity in terms of equal access to reliable and affordable basic care without any discrimination based on gender, religious or ethnic origin is an essential element of our joint WHO European Commission strategy. But this comes at the cost, and I want to use this occasion to pay my respect to all the health workers who during the past 12 months dedicated endless hours and continuous effort, sometimes with the cost of their lives. We are grateful to all of them, and they are the unknown heroes of our fight. This is also why we must continue to better equip the medical staff and the health workers, including at community level, continue to protect them against the violations of the international humanitarian law. We must strengthen our joint actions and advocacy to prevent health facilities from becoming scenes of war, or health workers or paramedics becoming victims of abuse or violence. For several years, the need for emergency response due to natural hazard is rising. Mortality due to lack of access to basic care, immunization, or food is increasingly related to extended periods of droughts, flash floods, repeated or stronger storms and cyclones. Climate change is taking its toll, and often the first victims are most vulnerable. Therefore, the provision of health services must be adapted, also in emergencies and humanitarian settings. Using most sustainable energies, reducing transportation costs and the carbon footprint. We must increase our efforts to take anticipatory action, such as prepositioning of equipment and countermeasures and investing in local solutions. Preparedness is the word. There are some elements that we are happy to further explore with the partnership with WHO and other donors, and increase preparedness and resilience, starting with community level, effective preventive measures, integrating our response with the activities developed by other sectors, is the real One Health approach that is very much high on our agenda for 2025. In these challenging times, these are only some of the activities that European Commission and my directorate especially is committed to implement during the coming years in collaboration with WHO. We will maintain our strong and constructive dialogue, unite forces through both the civil protection and humanitarian actions, and liaise with all other partners to maximize our common leverage. Once again, I wish to thank you for inviting DG ECHO at this event, and thank you for this useful exchange.
Thank you to the European Commission and to all supporters of WHO's work in emergencies. And finally, I am pleased to hand over to Dr. Mike Ryan, the Executive Director of the Health Emergencies Programme and Deputy Director General, who joins us live from Afghanistan.
Morning, good afternoon, good evening. I'm assuming you can hear me. Thank you, Fabia. It's been wonderful to listen and to listen to Anne, to Irina, to Zena, to Jennifer, Vanessa, Claude, Maha, and Hannah. And that represents both our partners, our donors across a wide spectrum of the areas in which we work. I'm joining you today from Kabul, and I'm very happy to be doing so. I'm here for the last couple of days. Yesterday, I met with WHO staff and health partners. I've met with the Minister of Health today, with the National Emergency Operations Centre Coordinator. I've had the honour of meeting with the humanitarian and resident coordinator today, and I'm joined in this briefing, though you can't see him on camera, by our country representative and director, Edmund Salvador. So Afghanistan remains one of the most pressing health crises in the world. The needs of the Afghan people are huge, right across the spectrum, from acute threats to health, including trauma, epidemics, and polio, to non-communicable diseases, mental health, maternal and child health, cancer, and across a whole range of different challenges and health needs faced by the people of Afghanistan. WHO, working with over 60 health cluster partners, has reached millions of people, directly reaching 8.4 million people in 34 provinces, providing medical kits that are supplied for the needs of 13.9 million consultations, providing over 3,000 emergency surgical kits across Afghanistan over the last year. We trained over 5,000 healthcare workers. We support directly 106 primary healthcare centres and 13 hospitals. We provide full operations support for a 100-bed national mental hospital that has provided care and access for 77,000 patients, and 5 regional level mental health boards providing care for 27,000 people. We support 141 IPD, severe acute malnutrition treatment centres across the country, and 12 drug addiction treatment centres with over 690 beds and 17 mobile outreach teams. We provide 4 inpatient treatment facilities for women and child drug addiction, with 190 beds and 6 mobile outreach teams. And we've launched a female-specific opioid substitution treatment clinics in Kabul and Mazur. With regard to the National Infectious Disease Centre, which I was at today, we provide full operational support to that national reference centre. Today, I was seeing patients with Crimean Congo hemorrhagic fever, with multi-resistant TB infections, an incredibly dedicated staff. We are currently building an upgraded imaging centre with CT scanning and other diagnostic capabilities. We're upgrading the intensive care unit so the doctors and nurses, both men and women, treating both men and women, have access to a better environment in which to save lives. We're also working to provide solar power and a full solar electrification project for that hospital, which is a major undertaking. This isn't a small primary healthcare centre. This is a full-scale tertiary referral centre, which we hope to be able to produce a significant amount of its own power over the next year. And as I said, in addition to providing full operation support for HR and supply chain in that hospital, we also support over 600 Sentinel acute surveillance sites, which have generated over 1,500 alerts in the last year. Of those alerts of potential outbreaks, 97% have been investigated within 24 to 48 hours. So within that context, you can see the amount of work that WHO with its partners is doing in countries. I just came from a meeting into this meeting. I had a fantastic meeting with our team that works on prevention and response to sexual exploitation and abuse and harassment, and with our team that works on accountability to affected populations and gender-based violence. And these are major issues in terms of our accountability as an organisation and ensuring that our partners and everyone we work with operates safely with a clear view that we must first do no harm in operational situations on the ground. More broadly than that, I speak here very specifically because I'm in Afghanistan talking to the elites here in Afghanistan. But I think Afghanistan reminds us of one of the most urgent challenges of global health in 2025. How are we going to continue to engage in countries that are affected by fragility and conflict? How are we going to deal with the intertwining and amplification of climate, of contagion, and of conflict, where countries are moving, and many of the countries here represented today in this health emergency appeal aren't dealing with one crisis. They're dealing with a multiplicity of crises that are continuing to undermine the capacity of the health system to deliver, but we will continue to do so. But in these countries, this is where the mothers are dying in childbirth and before. This is where the children are dying. This is where the high-impact epidemics are occurring. This is where the unmet need is. This is the future, and this is the battle we must win. Afghanistan is not the only place we're witnessing this compounding impact of conflict, displacement, climate change, and disease outbreaks. We've seen unspeakable devastation in Gaza and in Sudan and in other places. We're dealing with complex crises, and many of the speakers spoke today about in Ukraine, in Yemen, in Syria, in DR Congo, in Myanmar, in Haiti, in Somalia, South Sudan, Ethiopia, and many other places. I have to say with great sadness that our response to these crises and beyond is also further challenged by the blatant and consistent disregard to international law and the attacks on healthcare that continue to grow across the world. Afghanistan mirrors these challenges faced by communities worldwide, as I said, where conflict, displacement, and climate shocks intertwine. We've heard from the DG about the number of people worldwide that require urgent humanitarian assistance, and this includes health assistance. I think you've heard the testimonies of the partners online. I urge you to look at this health emergency appeal, to provide the resources that it needs. So WHO working with our partners, and again, I will state that WHO by itself can achieve very little. WHO working with governments like we do here in Afghanistan, working with partners like we do here in Afghanistan, we can make a huge difference. We can bring the coordination, we can bring the standards and the norms, we can bring the surveillance, we can bring the methodology that allows the work of all of our partners to be amplified in a way that meets the health needs of the people of Afghanistan and the people of the world. Thank you.